Question: do all blood tests really require a needle this big? No. In fact, sometimes all we need is this tiny little device. Today, we're uncovering the science behind why sometimes less blood is actually more than enough.
So, what is capillary puncture? Capillary puncture is a procedure used to collect a small amount of blood by puncturing the skin, usually from the fingertip, heel, or earlobe. It is commonly performed when only a small amount of blood is only needed for laboratory testing.
Now that we know what capillary puncture is, here's another question. If healthcare professionals already collect blood using a syringe, then why do we even need capillary puncture in the first place? Why not just use a regular needle for everyone? Well, imagine finding a very tiny straw hidden under a marshmallow. That's what finding a vein in a newborn can sometimes be like. That's why capillary puncture is a method of choice for infants and children below the age of 2 years old. But that's not the only reason. First, the veins are so small that even inserting the smallest needle can be difficult. Second, those veins need to be preserved for something much more important, like IV therapy. If a baby becomes sick and needs medications and fluids, then healthcare providers needs those veins available. Third, infants have a very small total blood volume. Removing what seems like a small amount for us is actually a large amount for them. If too much blood is collected, the infants can develop iatrogenic anemia. Let's break the word down. Anemia means there is not enough red blood cells. Iatrogenic means it was caused by a medical procedure. So, iatrogenic anemia is anemia caused by removing too much blood during testing. That's why healthcare professionals are carefully limiting the total amount of blood collected from infants. Another reason? Some tests are specifically designed to use capillary blood. This includes newborn screening and capillary blood tests. Now, you might be wondering, okay, that makes sense for babies. But what about adults? Great question. Capillary puncture is not just for infants. Let's meet a few patients. This patient has severe burns on both of their arms. Finding a healthy vein can be difficult. This patient receives chemotherapy every week. Because treatment requires frequent IV access, we want to preserve the vein whenever possible. As we get older, our veins become more thinner and fragile. They can collapse easily during venipuncture. This patient tests for blood sugar several times a day. Imagine using a syringe every time. Instead, a quick finger stick can provide enough blood for glucose testing. Although capillary puncture is useful, it's not always the best option. A severely dehydrated patient has poor blood circulation towards their fingers. This means obtaining a good sample can be difficult. A swollen finger contains excess tissue fluid. If we collect blood here, the sample will be diluted and laboratory results will not be accurate anymore. Finally, some tests simply needs more blood than what capillary puncture can provide. Blood cultures, coagulation studies, and ESR require larger quantities collected through venipuncture. So the key takeaway is this. Capillary puncture is not chosen because it's easy. It's chosen because it's the safest and appropriate method for certain patients and certain laboratory tests. Science teaches us something interesting. Bigger isn't always better. Sometimes the smallest things, a small capillary, a small lancet, and a tiny drop of blood, can tell us the biggest stories about a person's health.
Now that we know why capillary blood is needed or why we collect it, let's discuss its components and what it's made of. As we know, capillary blood is collected to skin puncture, which is from your fingertip, the heel, or the earlobe. And unlike venous blood, which we usually collect through venipuncture, is not a pure sample of one type of blood, but actually a mixture of three components. So as shown on the diagram here, the first component is arterial blood, which makes up the largest portion, which is roughly 70%. This is oxygen-rich blood delivered by the arterioles into the capillary bed. So as we see in the diagram here, there's the arteriole, which fuses transitions into the capillaries where a capillary exchange occurs. And so, the second component is venous blood, which makes up about 5 to 10%. This is the deoxygenated blood that's given up its oxygen to the tissues and is returning to the venules. The third component is interstitial and intercellular fluid. Using this diagram to help us visualize it, the fluid surrounding and within the tissue cells, this gets pulled in during puncture along with the blood itself. Since we puncture skin, we can't help but get the fluid within your skin cells or within the skin layers. So that's why we wipe off the first drop of blood. Because of this mixture, capillary blood is sometimes said to resemble arterial blood more closely than venous blood due to a higher arterial contribution. This matters clinically because it's why capillary glucose readings can differ slightly from venous readings, and why its proper technique, like I said, wiping away the first drop and avoiding excessive squeezing, is critical. I forgot to mention, but excessive squeezing dilutes the sample further with its interstitial fluid, which can skew the results. And using this diagram here, we can see what the difference is between arterial, venous, and capillary blood. Understanding this composition is essential in point-of-care testing, which will be discussed later, pediatric and neonatal, specimen collection, and glucose monitoring, where capillary puncture is often the method of choice.
The equipment used for dermal puncture includes a sterile lancet to make the puncture, alcohol swabs to clean the site, sterile gauze, and cotton to stop bleeding, microcollection tubes or capillary tubes to collect blood, and gloves for protection, and a sharp container for safe disposal for used lancets.
Have you ever wondered why phlebotomists always wipe away the very first drop of blood during finger stick? Or have you ever wondered how a tiny heel prick on a newborn can safely provide enough blood for crucial lab tests without hurting the baby? It all comes down to a highly precise medical art, the dermal puncture proper procedure. Hi everyone! Today I am going to explain the proper procedure for performing a dermal puncture, whether it's a finger stick or an infant heel stick. Following these precise steps ensure a high-quality specimen and patient safety. Step 1. Precision and greeting. To begin with, always obtain and examine the requisition form. Immediately after, greet your patient and explain the procedure clearly. Step 2. Identification. Next, identify the patient verbally by asking them to state their full name. Simultaneously, compare with their ID band and requisition form. For pediatric patients, have a parent or guardian verify this information instead. Step 3. Verification and selection. Furthermore, verify any dietary restrictions, latex allergies, or previous issues with blood draws. Based on this data, select your microcollection equipment according to patient's age and test ordered. Step 4. Hygiene. Once everything is verified, thoroughly wash your hands and put on fresh gloves. For adults and children older than 1 year old, a finger stick procedure. Step 1. Positioning. First, position the patient's arm on a firm surface, hands palm up. On the other hand, if it's a young child, they may need to be securely held in a vertical or horizontal restraint. Step 2. Site selection. Following this, select a fleshy area located of the off-center of the fourth finger of the palmar side of the non-dominant hand. Keep in mind, however, you must never use the sides or the very tip of the finger, and avoid the thumb, index, or the fifth finger entirely. Step 3. Warming and cleansing. Warm the site if necessary. Afterward, cleanse the area with 70% isopropyl alcohol in a concentric circles and allow it to completely air dry. Tip: never puncture a wet alcohol as it causes stingy, hemolysis, and prevents rounded blood drop from forming. Step 4. Execution. At this stage, prepare the safety lancet. Hold the finger firmly between your non-dominant thumb and index finger, pointing downward. Place the lancet firmly against the skin perpendicular to the finger grooves, and subsequently depress the trigger. Step 5. Disposal and first drop. Immediately discard the lancet into the approved sharps container. Right after, gently squeeze and wipe away the first drop of blood with clean gauze to eliminate tissue fluids and alcohol residue. Step 6. Collection. Then collect the rounded drops into your microcollection container without scraping the skin. Do not milk the site. Crucially, you must collect the sample within 2 minutes to prevent microclots from forming. Step 7. Aftercare. As soon as you finish, cap the container, mix it 5 to 10 times by gently inversion, and apply gauze pressure to the site. Label the tubes before leaving the patient. Finally, if the patient is older than 2 years old, apply a bandage. Now, if it's an infant, we will be doing a heel stick. So these are the heel stick procedure. Step 1. Baby positioning. To start, position the baby lying flat on their back with their foot lower than their body to let the gravity assist blood flow. Step 2. Warming the heel. Prior to the puncture, warm the heel for 3 to 5 minutes using a warm washcloth or a commercial warming device. Consequently, this dilates the vessels and vastly improves blood flow. Step 3. Site selection. Next, choose the medial, lateral plantar surface of the heel. Crucial safety note: never puncture the arc or the back of the heel in order to avoid striking the bone and causing osteomyelitis. Step 4. Cleansing and puncture. Cleanse with 70% isopropyl alcohol and let it air dry. Following that, wrap your non-dominant hand firmly around the heel. Place your automated lancet perpendicular to the heel print lines and trigger the device. Step 5. Wiping and collecting. Just like before, wipe away the first drop of blood. Thereafter, collect the free following rounded drops into your tubes in a correct order of draw. Anticoagulated tube first. Again, do not scrape or milk the site. Step 6. Mixing and bandaging guardrail. Meanwhile, invert the microcollection tube 5 to 10 times to mix thoroughly with an additive. Apply pressure with the gauze until bleeding stops. Critical reminder: do not place a bandage or an infant under 2 years old since it possesses a serious choking hazard. To wrap things up, you must label your specimen right at the bedside. Make absolutely sure your labels include the 5K identifiers. First, the patient's full name. Second, their unique identification number or the date of birth. Third, the date of collection. Fourth, the time of collection. And lastly, the initial of the phlebotomist.
So what is point-of-care testing? So point-of-care testing, or POCT, refers to the diagnostic testing performed near or at the site of patient care, rather than sending samples to a central laboratory. This allows for immediate results, faster clinical decisions, and quicker patient management. Capillary puncture is commonly used for POCT because it's quick, minimally invasive, and only requires small blood samples. Some common examples include blood glucose monitoring for diabetic patients, hemoglobin and hematocrit testing, cholesterol screening, and blood typing in emergency situations. Because of its speed and convenience, POCT plays a vital role in clinics, emergency rooms, and even home settings, bringing diagnostic testing closer to the patient. And one of the most important applications of POCT is in newborn screening, where a simple capillary sample can detect life-threatening conditions early on.
Method. Newborn screening is a public health program designed to identify infants who may have serious but treatable metabolic, endocrine, and genetic disorders. Early detection allows prompt treatment, preventing severe complications and improving the child's quality of life. For accurate results, proper specimen collection is essential.
Now, to wrap up this video, we've walked through the essentials of capillary puncture, starting with what it is, when it's performed, down to its composition, the equipment we need, and the proper step-by-step procedure. We also looked at how this technique is applied in real practice through point-of-care testing and newborn screening, showing just how valuable capillary puncture is, especially for patients like infants and geriatric patients alike where venipuncture isn't ideal. As future medical technologists, mastering this skill isn't just about following the steps correctly. It's about ensuring accurate results and providing safe, minimally invasive care to our patients. And as always, thank you for watching and happy blood collecting!